I want to thank the OMA for the opportunity to speak about the newly formed Oregon National Medical Association chapter, the Cascade State Medical Association. Just what is the National Medical Association, or NMA? In 1869, 4 years after the end of the Civil War, some Black physicians meeting the eligibility requirements were recommended for membership in the AMA. They were voted down, and the related documents make it very clear this was a decision made on the basis of racial phobia. The vote was contested, and these physicians had significant support among some white members, but unfortunately not enough to change the vote. The policy of exclusion was applied toward all people of color and was not reversed until 1952. This was when nearly a quarter of the membership still voted against any changes. To determine the impact of the rejection of Black physicians by the AMA, let's look at the role it has played in the evolution of medical practice in the United States. AMA sets the standards for learning and practicing medicine in the country. Physician licensing entails passing a board examination. Hospital and medical schools need accreditation to be viable. All of this has been influenced by the AMA. For most physicians, practicing medicine would have been impossible without the reputation acquired, the ongoing education provided, and hospital privileges accorded through the membership in the AMA. AMA rejection of Black membership inserted Jim Crow into medicine, and this racist action led directly to the racial health discrepancies we see today. The generation and practice of Black physicians was curtailed when many whites were refusing to see Black patients. For a people already burdened with the residual impact of slavery, Jim Crow segregation, and the difficult adjustments in the post-emancipation years, this was a major strike against Black people. The NMA was formed in 1895. It was to be an organization which helped Black physicians. Its credo was written by Dr. C.V. Roman and reads as follows: conceived in no spirit of racial exclusiveness, fostering no ethnic antagonism, but born of the exigencies of the American environment, the National Medical Association has for its object the banding together for mutual cooperation and helpfulness the men and women of African descent who are legally and honorably engaged in the practice of the cognate professions of medicine, surgery, pharmacy, and dentistry. The NMA provided many of the AMA functions for Black physicians, such as camaraderie, social interaction, and a place where knowledge could be acquired and shared. Additionally, this organization also pushed for civil rights and universal health care. The NMA has targeted public health, chronic diseases, and many other issues which have disproportionately affected Black people. The accomplishments are too numerous to cover here. Why has Oregon taken this long to have an NMA chapter? The answer is not complicated. According to the US Census, Blacks account only for 2.2% of the population in Oregon. There were intensive historical efforts to limit the growth of the Black population here. Oregon has an ignominious history as the only state in the Union with a Black exclusion law. When this law was removed from the Constitution in 1927, the Black population was in the low thousands. Dr. De Norval Unthank practiced medicine out of his house since no hospital privileges were conferred on him. Black people did not go to the hospital because they were turned away. The Ku Klux Klan had a significant Oregon presence in the 1920s, with as many as 35,000 members. Oregon's own local version of Jim Crow segregation was legal until the 1950s and 1960s. Subsequently, racism became more subtle, with redlining, school segregation, real estate tendencies, overly aggressive policing, and limited employment opportunity. Our hope is that our organization will be active in promoting the health and well-being of the BIPOC community in our state. This is given that the available statistics show significant health outcomes disparities here. We will be advocating for good record keeping with regard to these numbers so that progress or lack thereof can be evaluated and addressed. We expect to be involved in mentoring and encouraging students in our communities to enter and persevere in medical professions. And we will also provide a robust nexus for Black physicians and their allies in our state. We will also be involved in efforts to improve the vaccination rates in communities of color, where there has been significant hesitancy. Many members have been doing this already, but now we have the synergy of working together as an organization. Oregon has been a revolving door for Black physicians over the years. It is expected that the presence of an NMA chapter may help to reverse this trend. The Oregon of today is very different from its past history. Ultimately, we want to see an end to all health disparity, be they racial or otherwise. The NMA chapter, which has come together over the last year, has energy and is ready to get to work. Thank you.